Hey guys, I'm Dr. Josh Jagoda. Today we're going to talk about thoracic spine disc herniation. So if you're familiar with the spine, you know that we pretty much have three different areas: the cervical, the thoracic, and the lumbar regions. And the thoracic spine doesn't get a lot of attention when it comes to disc herniations or disc bulges, often because they resolve really well. So if you're suffering a disc herniation in the thoracic spine, now, I'm not saying don't get checked. I'm not saying don't get an MRI. I'm not saying don't do anything. I'm saying consult your provider, but I'm not overly worried about them. There's a few reasons why I'm not overly worried about that. But one, they don't happen as often. One of the reasons they don't happen as often is because we have the thoracic cage, meaning our rib cage, that attaches all the way back around into our sternum over here. So if you think about that, that helps to reduce compression and extension, and it doesn't allow the thoracic spine to move. So if you notice, we kind of like have this kind of like cage around us, right, to help protect our vital organs and stuff like that on the inside. But as a result of having that cage, you don't really have as much good mobility or movement as you do in the cervical spine or the lumbar spine. And as a result of that, the cervical and the lumbar spine tend to have more, I guess you could say, detrimental effects and more symptom-based problems when it comes to herniations and disc bulges that put pressure on a nerve and that gives you sciatica or hand and arm pain and numbness. But if you are having a thoracic spine disc herniation, a lot of times the nerves that go around or that are affected go around into this area. So they'll wrap around the cartilage area, and so a lot of people will maybe think it's a rib injury. They'll feel like kind of radiated around the back. They'll have some numbness or tingling along the side. And so those are really the symptoms that you'll kind of have as a result of a disc herniation within the thoracic spine. They also typically, because they're so structurally stable, typically as a result of that rib cage, they tend to heal pretty well overall. So now, again, I'm not saying that you should avoid this at all or avoid seeking care, but I am saying that a lot of times that people are really overly careful. They're overly conscious about thoracic spine disc herniations. And yeah, it's good to be cautious, but I'm just saying that as a result of it, typically they resolve very, very well. Same thing with low back and neck herniations. If you do the proper rehab, they just take a little bit more rehab. But the thoracic spine disc herniations, I'm typically not too worried about it. And so I've gotten a couple questions on why you should worry about it, why you shouldn't worry about it. And just a little bit of information out there because I think they're not really talked about a lot. And as a result, them not being talked about a lot, it's really kind of hard to find some information out there. So hopefully, guys, this helped you a little bit. But don't worry too much about thoracic spine herniations and disc bulges. Just know that no matter what you do, whether it's neck, mid-back, low back, sacrum, leg, knee, hip, it's always a good idea to get stronger. It's always a good idea to rehab, and it's always a good idea to consult a doctor who knows what they're doing with regard to these types of injuries. So guys, that's it. Hopefully this helped you a little bit, explain a little bit more about thoracic spine disc herniations, some of the symptoms, some of the things that you should look out for, and what to kind of expect if you are suffering from it. All right, guys, I'm Dr. Josh Jagoda. Thanks for stopping by. We'll see you guys next time. Don't forget to subscribe to our channel. See you guys.